morning. My name is Fabiola Landeros. I'm the civil right and immigrant right organizer from el Centro de Igualdad de Derechos, and Albuquerque-based Workers' Justice and Immigrant Rights Organization. On behalf of Economic Relief Working Group, we would like to welcome you to our press conference. The Economic Relief Working Group members are Somos un Pueblo Unido, New Mexico Café, New Mexico Voices for Children, Partnership for Community Action, and el Centro de Igualdad de Derechos. Okay, a coalition with a statewide geographic, rich, and a strong track record in community organizing, leadership development, research, policy development, and advocacy, power building. And now, to keep having this good conversation, I will pass it over to Marcela to discuss broader work of our coalition and the impactful result of our statewide guaranteed income program.
Thank you, Fabiola. Hi, my name is Marcela Diaz with Somos un Pueblo Unido, a statewide immigrant-based economic and racial justice organization. And I wanted to just give a little brief history of the Economic Relief Working Group, these organizations that are in the room today. We came together at the onset of the pandemic because we knew that mixed status families would be left out of economic relief payments and federal economic relief payments, as well as unemployment. So we worked with Voices for Children and all of our organizations to do a report called Essential but Excluded, because many of our families and workers in our community were still working, were risking their lives to go to work, because we knew that we would not have access to unemployment or other forms of economic relief payments that others had across the country and in our state. And we calculated, or Voices for Children, that there were about 16,000 workers who were ineligible because of their status for unemployment and the additional unemployment payments that the federal government was providing through our states. And we also knew that about 68,000 workers and their children were going to be excluded from economic relief payments. And we knew what kind of terrible impact that was going to have very early on. So we came together to organize for additional funding through the state and local cities and counties. And that's what we did. Together, we were able to raise and organize for over $37 million in state funding, ARPA funding, CARES Act funding that came through the state and through our localities, and local funding as well, local general fund monies to go directly to folks who were essential but excluded. And that really was a lifeline for a lot of our families. And so knowing that that was a lifeline for our families, we thought, what would it look like to have not just these one-time payments, but recurring cash payments through a form of guaranteed income, not just to help make our ends meet in the moment, but that could also help us get ahead, get us back to work, give us the means that we needed to pursue better job opportunities, which is going to be a big theme of the research that is going to be presented today. So with that, I want to turn it over to Nichelle Gilbert, who is the Executive Director of the Partnership for Community Action, to talk a little bit more about the just the work that we did as community-based organizations and as power building organizations to form and raise funding for this really important GBI, the first of its kind in the country, statewide GBI pilot. So, Nichelle.
Thank you. Good afternoon, everyone. Good to see all of you. Thank you for being here. I want to remind, if there are press in the room, that Sharon Kane is in the back. She'll raise her hand and she has her press kits for you. So thank you to Fabiola and to Marcela for the framing and the introduction. And I appreciate the opportunity to delve into three key things with you today. A high-level overview of our guaranteed income pilot, emphasizing the focus on supporting immigrant families and essential workers, and uplifting the connection between our recommendations and workforce development in the context of a state-sponsored guaranteed income program. As Marcela highlighted, our group joined together to address an immediate community need, and we were activated by the reality that thousands of families were excluded from federal relief during times of unprecedented instability. Having successfully secured and deployed millions of dollars in relief for immigrant families and gathering compelling anecdotal stories Illustrating the transformative impact of that cash assistance, the Economic Relief Working Group recognized the imperative to do more. This group engaged in collaborative sessions with national leaders in economic mobility strategy, including the Economic Security Project and Springboard to Opportunities. Through these interactions, we embarked on a journey of popular education, drawing on community articulated priorities, shared insights, and experiences to design and implement our pilot. The pilot enrolled 330 participants from mixed immigration status households, addressing a pressing need in our state. Among thousands of applications, these participants were randomly selected to be a part of this first of a kind pilot in the state of New Mexico. Over the course of 12 months, each participant received $500 per month. And it's really critical to emphasize here that the funds were provided without condition or strings attached. This demonstrated our commitment to equity and progressivity in the pilot. A core tenet of guaranteed income is the deliberate rejection of any restriction or undue requirement. And so in this pilot, we really disavowed any prescriptive allocation or any detailed expenditure justification. And in doing so, we ensured that financial support was equitable and beneficial in a non-paternalistic framework that approached and centered dignity and self-determination. Reaching 13 New Mexico counties, the pilot placed particular emphasis on a rural-urban split, acknowledging the challenges faced by rural participants in regard to resource allocation and access. Our pilot centered support for immigrant families and essential workers. According to the 2020 study from New Mexico Voices for Children, over 68,000 New Mexicans fell through the cracks when it came to federal economic relief during the pandemic. Many families were unable to access federal stimulus rebates, unemployment benefits, or paid sick leave due to their immigration status. Local government and private security net programs also missed the mark due to bureaucratic obstacles and onerous requirements. Homelessness, increased debt, reliance on predatory loans, and economic insecurity remained acute, harming the long-term health and economic outcomes for families. The pandemic underscored the impact of immigrant exclusions as well as their adverse impact on public health and local economies. According to New Mexico Voices, exclusions from federal stimulus checks resulted in a loss of $55 million to the state. And more importantly, unemployment exclusions resulted in a $2 million weekly loss to unemployed workers. Our recognition of a gateway from one-time economic relief programs to broader systemic changes propels our efforts to eliminate statutory obstacles for immigrant families, increasing access to cash benefit, and expansion of cash transfer programs. Finally, our recommendations are aligned to strengthen New Mexico's workforce development infrastructure. Supplemental income while in training is a part of the support needed by workers with low wages and difficult to reach workers to provide pathways to participate in adult education, pre-apprenticeships, apprenticeships, and certification programs. A state government sponsored and administered guaranteed income pilot for workers in workforce development and job readiness programs would help to mitigate shortages in critical industries like early childhood, empower workers to leave exploitative employment, and provide access to quality employment and advancement opportunities, bringing workers into the workforce. We heard this morning that ECUCD seeks to expand its care for children by 30% from FY25 to FY29. We need workers, and we need to make sure that we're providing equitable access to those opportunities. So with that, I would like to turn it over to Javier Rojo, Senior Researcher and Policy Analyst with New Mexico Voices for Children. The report, Guaranteed Income, Increasing Employment and Helping Families Thrive, really challenges some of the research that we heard on Monday around national studies on the impact of GBI on participants. And moreover, it's a vital contribution to the broader movement toward guaranteed income as an integral component of equitable economic opportunity and inclusive economy. Thank you. Javier.
Thank you, Michelle, for that great introduction, and thank you, everybody, for being here. My name is Javier Rojo. I'm a senior policy analyst with New Mexico Voices for Children. Professionally and academically, I'm trained as an economist, and that's the role I've played for this group in the last 3 years. Together, we published reports and analysis examining the economic impact immigrants have on New Mexico. The philosophy guiding our research, which was deeply influenced by our grassroots partners, is that research should be community-based, meaning that the research should be relevant and responsive to the experiences and needs of the communities facing these issues. That is why our community-based partners not only helped design the research project, but their members also participated in the implementation. We are big fans of bottom-up approaches to solving problems, and that's the approach we use here. So what is guaranteed income and guaranteed basic income? Terms that are often used interchangeably, even though they mean different things. First, what do they both have in common? In both programs, participants receive a flat monthly payment for a set period of time with no strings attached. The guiding principle for this approach, as Michelle stated, is that people know best how to spend their money because they know they have the best understanding of what their needs are. Guaranteed income programs provide income that is supplemental and not intended to meet all the basic needs. For example, in one of the first GI pilot programs in the country, 100 residents from Stockton, California, that came from low-income neighborhoods were given $500 per month for 18 months. Obviously, 500 isn't enough to meet your basic needs, especially in a place like California, but it does supplement your income to help you get there. In contrast, guaranteed basic income programs provide income large enough to meet a person's basic needs without additional income support. In Kenya, there's a program involving 6,000 participants where they calculated how much folks needed to survive, which is about 65 cents per day. And then they give them an income that was slightly above that. And they're doing this for an entire decade. The first 2 years of the research just came out and they've sort of reinforced some of our findings that are also super exciting. As of right now, there are over 100 pilot programs like these across the country, targeting different sorts of populations. In Georgia, there's one targeting Black mothers. In California, there's multiple pilot programs focused on people experiencing homelessness. In Santa Fe, we have one targeting college students. So this is very much a growing movement. So what about our program? Oh. Our program is a guaranteed income program. We received applicants from across the state and then randomly selected 330 families. 2/3, 225 participants came from urban counties, and those urban counties were Bernalillo, Santa Fe, and Doña Ana. The remaining 1/3, 105 participants, came from 10 rural counties, which included Chavez, Curie, Rio Arriba, San Juan, Luna, McKinley, Lee, and Hidalgo. We did this not only because we wanted a broad representation of the state, but also because we wanted to see if there were any meaningful differences between urban and rural populations, which they were. To be eligible for this program, participants had to come from mixed status households, meaning at least one person in the household had to be undocumented. And they needed to have at least one minor or disabled dependent. Participants received $500 per month for a total of 12 months. A subset of this population, 50 participants, received a 6-month extension, meaning they received $5,000 per month for an additional 6 months. In all, our pilot program was 18 months long. So some demographic data about our population. Approximately 4 out of 5 participants were female. Participants had on average 2 children. 96% of participants identified as Hispanic or Latino or Latinx. 77% owned their own homes. 46% of participants use Spanish as their primary language. Why do we target mixed status families? As some people have already sort of mentioned, because not only were they excluded from the pandemic, from any pandemic, but they are largely excluded from most of the social safety net, which means during difficult times, they usually get very little help. This despite the fact that mixed status families and undocumented immigrants make meaningful contributions to our economy. Each year, they pay about 68 million in local and state taxes in New Mexico. And immigrant-owned businesses employ 27,000 New Mexicans. I highlight this because there's this misconception that mixed status families and undocumented workers get benefits from the system, but they don't make contributions. Nothing is further from the truth. The opposite is actually true. Undocumented folks make meaningful contributions to the system, and rarely do they see any of these benefits. So how do we evaluate this program? Well, we used a mixed methods approach. We designed and administered a quantitative survey, and we conducted qualitative interviews with program participants. The surveys included 19 closed-ended questions that covered 5 categories. Economic security, where we asked people about their employment status, if their work hours had been cut, and whether they were able to save money. Housing security, where we asked people if they were struggling to pay their rent or mortgage, or equally as important, if they were making difficult trade-offs in order to pay their rent or mortgage. Food security, where we asked people if they were skipping meals or how often they were worried about running out of food. Health, where we asked people if they had health insurance, were they vaccinated. We even asked about their mental health. Family and child well-being, where we asked about the members in the household. Were the kids on track to graduate from their grade level? How much time do you spend with your children? The survey was administered 4 times. The first time right before the pilot program began in April 2022. The second time right after the program concluded, the 12 months concluded in February 2023. The third time right after the 6-month extension concluded, we administered the survey to participants that received the extension. Lastly, we administered the survey to participants who had participated in the year-long program but didn't receive the extension. This group served as our control group. Additionally, a few months before launching the pilot program in December 2023, we commissioned a poll of 1,000 New Mexican families. The results from this poll served as a baseline to compare how our population was doing relative to other New Mexicans that share similar characteristics. Upon conclusion of the 18-month pilot program, we conducted 10 interviews with program participants. We designed an interview guide with 9 open-ended questions. The interviews were typically an hour long, and they were all in Spanish. Although I was present at all the interviews, most of them were conducted by members from these communities. And the reason for that was we wanted participants to feel as comfortable as possible. For many, it was the first time doing an interview, and they were sharing very sensitive information. So we wanted folks to be there with somebody they could relate. That was one of the better ideas we had, because the information they were able to pull out was really amazing. So kudos to them. All the interviews were recorded, transcribed, and translated and analyzed for patterns and common themes. And all participants were compensated for their time. So these are some of the results from our first survey, which essentially served as a diagnostic for our population. In comparison to other groups, there's very little data on mixed status household and undocumented workers because they are a hard population to reach, and they often, for very good reason, hesitate to share their private information. So I was really excited when we got the first batch of freshly baked data. And what we uncovered with our first survey were significant inequities. As this graph illustrates, mixed status families and undocumented workers are largely disconnected from our medical system. 74% of our participants are uninsured. 16% of their children lack health insurance. 1 in 5 remain unvaccinated, and they often forgo or avoid medical care because it's too expensive. In comparison, 10% of the Mexican adults lack health insurance, and 6% of children lack health insurance. And only 8% of New Mexican residents remain unvaccinated. So those are huge discrepancies. The first survey also captured high levels of economic and financial distress. 95% of participants reporting having to use their savings to pay their bills. In comparison, when we polled 1,000 Hispanic families in New Mexico, only 30% indicated having to use their savings to pay their bills. 47% of those participants working reported fewer hours or having unstable work schedules. In comparison, only 23% of Hispanic families in New Mexico reported having their hours cut. 85% of our participants reported experiencing difficulties in paying the rent or mortgage on time in the past year. In comparison, only 23% of Hispanic families report having the same issue. So again, huge discrepancies. Our participants also had higher levels of food insecurity. Undocumented residents and some undocumented residents and some documented residency, including DACA recipients, are ineligible to receive most federal public funding, including SNAP. More than half of our participants reported worrying at least once a month about whether their food would run out before they had more money to buy more. And 42% reported skipping meals sometime during the year. In comparison, only 13% of residents of New Mexico face food scarcity. So again, huge inequities. Lastly, local immigrant advocates and organizers have long observed disparities between immigrants residing in New Mexico's urban centers and those who live in rural areas. Through our survey, we were able to verify these observations. There are meaningful discrepancies between rural and urban communities. Rural participants are less likely to have received the COVID-19 vaccine, and their children are less likely to have health insurance. The children of rural participants were less likely to be on track to complete their grade level and graduate. Rural participants are also less likely to have a job. The urban participants face more of a housing burden than their rural counterparts. That's the only place where rural participants are doing a little better is in housing. So it is clear from our initial diagnosis that our population was really struggling and facing a number of challenges. So what happens when we give folks a guaranteed income? Do some of these challenges go away? Are some of these struggles mitigated? And the evaluation results say, yes. After receiving GI, our participants reported higher rates of employment, more stable work schedules, improved housing and food security, improved educational outcomes for children. However, we saw no change on health outcomes. More specifically, after receiving cash transfers for a year, our participants reported a noticeable increase in job security. This includes more employment opportunities and more stable employment. Rural participants reported a 14% increase in employment. Urban participants reported unstable work schedules decreased by 36%. Rural participants reported unstable work schedules decreased by 17%. Participants who received the extension reported a 15% increase in employment. So how is it that GBI helps people improve their economic opportunities? Well, allow me to quote one of our participants. The GI assistance helped me so much with everything. It helped me pay for utilities. It helped me pay for groceries. I was able to pay down some of my debt. It even helped me buy my own cell phone. I clean houses. At the beginning of the pandemic, I didn't have a phone. So it was very difficult for me to connect with potential clients. With the help of my new phone, I've been able to set up more appointments and create a more stable work schedule. There's tons of stories like that in the report. In the report, there's also a story about a participant who bought a car for the family, which allowed the daughter to drive to work, thereby bringing a second income into the household. So what is the principle at work here? The participants are reinforcing what any good business person knows, that you need money in order to make money. These findings are in line with what other pilot programs have found, that when you give people money, they invest in themselves to improve their economic opportunities. There's clear evidence that our GI pilot program improved housing security for participants of the program, in particular, those who were struggling the most to make rent or mortgage payments on time. For example, the number of respondents reporting that they had trouble paying their rent or mortgage on time almost every month decreased by 35%. Perhaps even more impressive, the group that received a 6-month extension experienced a increase in respondents reporting never having trouble paying their rent or mortgage on time. Again, to quote a participant, the GI assistance helped me the most with my housing situation. During the pandemic, nobody wanted their house cleaned. As a result, I was 5 months behind my rent. I was able to pay a portion of it. It would take me 2 months to make a payment to make 1 month worth of payment of rent. The GI assistance helped me get current. It's important to note that these gains happen in a context that saw significant increase in rent and housing prices for a lot of New Mexicans. And it looks like our GI assistance helps shield folks from some of these increases. Despite experiencing a record increase in food prices during the lifetime of the pilot program, some participants still saw improvements in food security. For example, the percentage of rural participants reporting to have never skipped a meal in the last year increased by 12%. The percentage of rural participants reporting to have received food from a food pantry dropped by 14%. For urban population, there were no noticeable changes in terms of food security. From the perspective of the research team, there are 2 reasons for this discrepancy. Urban populations tend to bear higher housing costs than their rural counterparts, and housing costs skyrocketed in urban centers after the pandemic. Due to higher housing expenditures among participants from urban areas, their budget allocation for food was comparatively reduced, thereby intensifying their vulnerability to food insecurity, in contrast to rural participants. And here's a quote from a participant about how GI mitigated food insecurity. Before the pandemic, I was working a lot cleaning houses. When I started, I had a lot of cancellations. I was pretty much working part-time. I never asked for assistance. I worked my whole life, so I've never needed to. But the pandemic was different. There was no work. When I started receiving the GI assistance, I felt more secure because I could finally get up to date on my bills. I could buy enough food for the whole family. I could afford medicine for myself and diapers for my baby. Participants with children reported noticeable improvements in educational outcomes. The percentage of participants reporting their child is on track to complete their grade level and graduate increased by 9%. For rural participants, this increase was even greater. It jumped by 13%. Households that received the 6-month extension maintained the 9% increase, but did not register additional gains. There's strong evidence that programs that provide cash payments to families, like the child tax credit or the state's working families tax credit, have a positive impact on educational outcomes for children, both in the short term and in the long term. Here's a quote from a parent about how GI helped her support her children. Because my child has cerebral palsy and I'm his primary caregiver, it's really difficult for me to work long hours. I piece my income together by cleaning houses and doing seasonal farm work. Because of the GI assistance, I was able to work fewer hours and spend more time with my child. Although we have anecdotal evidence from the peer-to-peer interviews that participants use the GI assistance to purchase health insurance and offset some medical expenses, the group didn't register any improvements in health outcomes. Health insurance rates remained roughly the same for both adults and children, as did vaccination rates and self-reported mental health assessments. Indeed, there was a 27% increase in the number of participants reporting that they delayed or forwent medical treatment due to higher costs. So what is going on here? Here's where the peer-to-peer interviews come to the rescue. For one, all those interviewed lacked access to the federal tax credit, which reduces the cost of private health insurance. Without the tax credits, health insurance is too expensive for most participants to include in their monthly budget. As one of the participants put it, if I buy health insurance, it will come out of my rent or grocery budget. And at this moment, I'm prioritizing my house and food for my family. The participants we interviewed who had health insurance did so because they faced life-threatening illnesses. So only folks who really needed it. Because of the lack of health insurance, participants are less likely to interact with the medical system, which means lower vaccination rates, fewer visits to the doctor, and more undetected and untreated illnesses, including chronic health conditions. The majority of the participants we interviewed have never been covered by health insurance, despite grappling with chronic health issues that progressively worsen due to unaffordable medical visits. The lack of accessible and affordable health insurance perpetuates cycles of declining health and financial instability for these families. And to deal with it, we have to look beyond GI assistance and identify policy mechanisms that may help us solve this problem. To quote a participant, health insurance worries me the most. Without my health, I can't work. Conclusion. So what did we learn? Oh, yeah. So what did we learn? For one, we uncovered deep inequities between mixed status families and the rest of the state's population. We also uncovered inequities between our urban and rural populations. In terms of our pilot program, the outcomes, we learned that guaranteed income helps improve employment opportunities and create economic opportunities. It creates housing and food security, and it has an outside impact in rural communities. Their increase in employment was greater. It helped them with food security, and it improved graduation rates for their children at higher rates. And we also know that it didn't seem to have an impact on health outcomes. So in terms of policy, how can we use this? So we have really strong evidence that GI helps mitigate economic disruption, like when a bunch of people lose their job all at once, as was the case during the pandemic. For our population and for a lot of other population, it helps because it gets people some breathing room to decide what to do next, and it gives them the means to invest in themselves to generate more income in the future. That's why we think that a guaranteed income program paired with some sort of job training is a really powerful tool to deal with economic disruption in communities that lose a lot of jobs because of industrial decline or whatever the case may be. Secondly, GI can help mitigate some social inequities. Take the housing crisis. The long-term structural issues associated with the housing crisis have to do with the lack of housing. We have to build more homes. To do that could take years. Struggling families don't have that luxury. So to deal with this problem in the short term, we can provide folks that need it the most GI assistance to cover their rent or mortgage and avoid eviction. So to summarize, we learned that guaranteed income may not be the silver bullet for all our woes, but all our social woes, but it most certainly helps with a whole host of issues. And to quote one of the participants, after all the terrible things that happened to us during the pandemic, losing our jobs, having absolutely no money, my husband passing away, injuring my back in the car accident, the GI assistance was the only glimmer of hope we got. It's how we survived. And with that, I conclude my presentation. Thank you.
Thank you, Javier, and thank you, Nichelle. Now to keep going with our press conference, we're gonna invite some of the participants of the program, and we're gonna start with Claudia Perez from Santa Fe. Yes, before we start the English media, I wanna take some interpretation equipment because it will be too hard to be doing both consecutive interpretation for our participants. We can give it to you. If you can raise your hand, I will take it to you. Anyone? No? No? Okay. Claudia?
¿Qué tal? Muy buenas tardes. Me da mucho gusto estar aquí porque fui beneficiaria hace 2 años y estoy completamente emocionada y se me sale el corazón de que me hayan tomado en cuenta. Mi nombre es Claudia Pérez, soy miembro del Centro de Trabajadores de Somos un Pueblo Unido. Fui beneficiada del programa GBI, el cual fue de mucha ayuda para mí porque no calificaba para beneficios públicos por parte del gobierno y tenía a mis hijos dependiendo completamente de mí en la universidad. Este apoyo económico fue especial para mí y para mi familia, ya que pude solventar los gastos que tenía sin necesidad de endeudarme. Principalmente me ayudó para que mis hijos no pudieran dejar la universidad. Actualmente tengo un hijo DACA, 22 años, y está ahorita en su 2º año de la escuela de la UNM estudiando medicina. Mi hija de 21 años se va a graduar este mayo de arquitecto y actualmente mi hijo de 19 años está estudiando ingeniería en la Universidad de la UNM. Es por eso que es muy importante que este gobierno, locales y estatales, tomen en cuenta reportes como este que se está dando a conocer el día de hoy ya que puede ser importante el rol que tienen los ingresos garantizados para que las familias de que beneficios, desventajas en nuestra comunidad en general, ya que cuando las familiares progresan y no son dejadas atrás, toda nuestra comunidad se ve beneficiada. Yo estoy muy agradecida por la oportunidad que se me dio a mí para recibir estos ingresos y espero que nuestro gobierno dé este tipo de oportunidades a muchas otras familias que, como la mía, en este tipo de apoyo salió adelante. Gracias.
Thank you to Claudia for sharing her story with us. And our next speaker is Elsa Enriquez from Farmington.
Hola, buenos días. Mi nombre es Elsa Enríquez. He vivido en Farmington desde hace 8 años. He sido miembro de Somos por 3 años. Fue a través de ellos que me enteré del programa de GBA. Cuando empezó la pandemia, yo estaba trabajando limpiando casas. Dado la pandemia, me recortaron mucho las horas de trabajo y a mí, como trabajadora esencial, me afectó muchísimo porque soy madre soltera de 4 hijos. Dado a que yo ya no estaba trabajando y era la única proveedora de mi familia, estábamos batallando para pagar nuestras facturas. El trabajo paró, pero teníamos los mismos gastos. Entonces decidí aplicar a esta ayuda porque era casi imposible para mí cubrir todos los gastos de mi familia. Necesitaba desesperadamente un apoyo financiero. En febrero del 2022 empecé a recibir la ayuda financiera del GBI. Este gran apoyo económico me ayudó a pagar la renta de mi vivienda, comprar ropa y calzado para mis hijos. También compré comida, medicamentos, pagué mis cuentas de utilidades como agua, luz y gas. También pude comprar refacciones para mi carro ya que lo tenía descompuesto. Este dinero me llegó cuando más lo necesitaba porque no había trabajo por la pandemia y a toda mi familia dependía de mí. El programa de GBA nos ayudó a mantenernos estables y a poder sobrevivir la pandemia. Pudimos después regresar al trabajo gracias a la estabilidad que nos trajo el GBA. Nosotros merecíamos recibir el programa de GBA, trabajamos por muchos años y cuando más lo necesitábamos fue una ayuda increíble y sé que lo hubiera sido para muchas otras familias. Al terminar este apoyo económico de GBA, mi situación financiera sigue siendo difícil porque sigo teniendo menos horas de trabajo y como trabajadora esencial me afecta muchísimo. GBA ayudó a las madres solteras trabajadoras de bajos recursos como yo a sacar adelante a sus hijos. Ahorita estamos batallando para conseguir trabajos dignos con salarios dignos. Es más difícil mantener estabilidad ahora que cuando teníamos GBA. El programa fue una parte esencial para nuestra estabilidad económica para seguir viviendo en Farmington y trabajando en Farmington. Recibir GBA ayudó a que yo, como trabajadora esencial por tantos años, me sintiera confiada de que mis hijos tuvieran comida en la mesa porque habría un dinero extra y seguro. Es importante que sigan los programas de GBA porque la crisis económica aún sigue y los trabajadores esenciales y de bajos recursos como yo hemos contribuido a la economía de este país por muchos años.
Thank you, Elsa. And our next participant is María de Jesús from Albuquerque.
Buenos días, mi nombre es María del Carmen de Jesús Guerrero. Estoy aquí. Estoy orgullosa de Nuevo México, haya sido mi hogar donde crié a mi familia durante 23 años. Soy una orgullosa madre de 3 hijos y abuela de 2. Anteriormente trabajaba en un restaurante y mi esposo trabaja en mantenimiento. Estoy aquí para hablar sobre el impacto positivo que tuvo el progreso de ingresos garantizados en la familia en un momento de la pandemia, en la que la situación económica de muchas familias de Nuevo México, como la mía, era muy difícil. Mi esposo, como la mayoría de los trabajadores esenciales, con salarios bajos, tuvo que seguir trabajando durante la pandemia. En ese momento no tenían días de pago por enfermedad. Útiles los $500 de GG al mes para pagar biles porque los biles no esperan y comprar comida, ropa y otras necesidades básicas para la familia. El programa fue una salvavidas y me gustó que mostró confianza en como la familia de clase trabajadoras como somos capaces de tomar decisiones sobre cómo gastamos nuestro dinero.
también lo veo como una inversión en la familia de Nuevo México y que construimos como trabajadores, contribuyentes y consumidores. Mi esposo y yo también hemos sufrido abuso laboral en trabajos anteriores. Tener G daría a los trabajadores opciones para buscar un mejor empleo en un lugar y no sufrir en silencio para sobrevivir. Siempre tuve el sueño de ser enfermera, pero nunca pude realizarme porque estaba demasiado ocupada, creando una familia y trabajando, y no tenía la oportunidad de ir a la escuela. Me enorgullece decir que mi hija hizo realidad mi sueño, convertirse ella misma en enfermera. Imagínense, si personas como yo pudiéramos participar en programas de ingresos básicos garantizados, podríamos volver a la escuela y contribuir en enfermeras o cuidadoras infantiles y contribuir aún más a la sociedad. Gracias.
Thank you, Maria. And our last participant is Elisa from Las Cruces.
Buenos días. Mi nombre es Elisa y estoy con Nuevo México Café y esta es parte de mi historia. Estoy en Nuevo México desde el 2005. Soy madre de 4 preciosos hijos y desafortunadamente, como una de tantas familias de estados mixtos que no tienen la oportunidad de trabajar legalmente, encontré una oportunidad para mi familia con el programa GBI, que me ayudó muchísimo. Pagos esenciales de mi hogar, como medicamentos que necesito para mi diabetes, como útiles escolares y ropa para mis hijos. Si el GBI fuera permanente, sería una grandiosa ayuda para muchas familias, especialmente en estos tiempos tan difíciles. Y si hubiera otras oportunidades para papás de hijos ciudadanos, en mi caso, mi hija de 16 años que es discapacitada, que necesita chequeos médicos, cirugías que solamente se pueden realizar en Albuquerque y tenemos que cruzar un chequeo de inmigración, pero se me dificulta cruzar y desafortunadamente no cuento con familia aquí que me apoye en estos casos. Como en el 2019, mi esposo fue deportado y dejando a su familia e hijos y a uno de ellos con tan solo 3 meses de nacido. Fue un golpe muy duro para mi familia y solo por querer sacar a su familia adelante y querer superarse. Por eso necesitamos un cambio y hacer valer nuestros derechos como todos los demás. Gracias.
Thirty participants, like so many other GBI pilots and their rigorous research, that having stable payments, recurring payments have helped people get back to work, have helped them pursue better quality jobs, access to jobs, training, education, as one of the members said. And it is a tool that we really think policymakers should be using more in New Mexico, especially given that the Department of Workforce Solutions has recently calculated that there are about 35,000 jobs right now that are unfilled by New Mexicans and that need to be filled just for us to catch up. And so this is a tool to help folks get the training that they need, the education that they need, do the apprenticeship programs that they need, and get back to work and enter the formal work system for the first time for many, re-enter it or become fully employed. And so and it helps with their childcare. And so we're really looking to the state to really think about how GI and supplemental income can help with workforce development. I also just want to say that at the beginning of the pandemic, Somos un Pueblo Unido and other partners at the Economic Relief Working Group, El Centro, Café, and PCA, we're trying to figure out how to get cash relief payments to mixed status families in the tens of thousands. What we knew is that none of our nonprofit organizations had the ability to cut those checks to that many people. So we insisted and worked very closely for the first a round of state economic relief payments with the Human Services Department of New Mexico, because we really think that government-sponsored and government-administered GI is important because our state already has the ability through the Department of Workforce Solution and Unemployment and other forms of cash assistance through HSD. They already have the ability to vet and to provide ongoing recurring payments to folks. And so we utilized and worked very closely with this administration and the New Mexico HSD to be able to provide that first round of state funding. But we also recognized that that the cities and the counties and that our GBI pilots that are philanthropically funded didn't have a platform through which to cut recurring payments or checks. And so we had to look for outside help, and we found it with an organization called Up Together, which is a national organization that really is looking for systems change. And they work with organizations to disrupt the status quo. I'm reading off their website, approach to ending poverty, because what we're seeing isn't working. And so they were able to really create a platform for the city of Santa Fe, the county of Santa Fe, for Bernalillo County, for the city of Albuquerque, and for our pilot and many others around the country to be able to provide these cash payments to folks in a very timely and efficient way. So with that, I do want to say that this project is funded like so many GBI pilots around the country by philanthropic dollars, but there is a movement, and we're starting to see a lot of state funding and city and county funding around the country actually start these GBI pilots. And so that's what we're looking to. We have been at the LFC meetings yesterday and today. We have a surplus. We really want to see this as a tool utilized in the future. So I want to turn it over to Ivana Netti. I just want to say that not only did they provide the flat platform to give folks this money, but they actually kicked in. Kicked in is probably not the best word. They funded with their incredible fundraising talents nationally with an over $2 million investment in the actual GBI. We had other funders like Kellogg and others fund the administration, the design, the research, all this work that it took for our grassroots organizations and voices to get this off the ground. But without Up Together, their platform and the money that they were able to find for us, we would not have been able to have this unprecedented project that will really contribute to the GBI field across the country. So Ivana Netti, she is the Senior Director of Partnership.
Thank you.
Up Together is proud to be one of the partners for the Guaranteed Basic Income program here in the state of New Mexico that's helping immigrant families. Up Together has been working in New Mexico since 2014. At the time, this idea of providing unrestricted cash transfers and trusting that people knew what was best for themselves was radical. Here we are today with this radical idea that has become a priority for the state for different cities in the state as well. All combined, there has been close to $25 million that the state and local municipalities have invested directly in more than 32,000 households across the state, including $11 million that been distributed through Up Together. Over the last few years, Up Together has provided close to $200 million in cash assistance to more than 200,000 people across the country, including New Mexico, which is also one of the very few states across the country that is hosting pilots that are statewide like this one. And I would say it's probably the only one that's doing it to immigrant families across the country. We're excited to see the results in this. We're excited to see that the results in this pilot confirm that poverty is a policy choice and that the cash is a powerful tool to address systemic inequities. People need full choice and control over their lives. They know what's best for themselves and their families. By trusting and investing in people, we celebrate their ability to find their own ways to get ahead. We're often asked, what is next after these pilots end? Well, we spend more than $400 billion per year into fighting poverty. in welfare programs, through which, as it was mentioned earlier today, most of those programs are deficit-based, or where people have to show their neediness, they have to show their deficit. Today, we're presented with an alternative that works, providing dignity and is efficient. Let's use the results of this pilot to provide policy solutions that expand cash assistance in people and communities. Through this groundbreaking pilot, we're making the case in New Mexico and across the country that we need to fundamentally change our systems. Thank you.
Thank you to all of our speakers. This concludes our press conference. Please, a round of applause to all the people who participated. Not to stand up here. Everybody, if you have any questions, you can direct your questions to Marcela Diaz or Javier Rojo, por favor. Please, thank you.
We have a question. Is there a plan to submit any implementation?
Is there a plan to submit implementation? Maybe we need a little bit more further legislation.
Is there a plan to submit any further legislation or budget request to expand implementation of
Can they hear me?
I didn't see it.
Yes, and so the Economic Relief Working Group will be working with legislators to try to expand government-sponsored, government-administered GI for specific, you typing me in? Yes, we will continue to work. The Economic Relief Working Group will continue to work. Sorry. They may be able to hear me. I don't know. With legislators to expand GI for specific policy proposals, like workforce development.
Yeah, I just said I can hear you, but I also typed it in.
Okay, sorry.
Okay, can New Mexico apply to receive guaranteed basic income or become part of the pilot soon?
No, the pilot has ended. You can hear me. So this 18-month pilot has ended, and this is the first day that we are releasing the report, and we will continue to do policy briefings or the briefings on the research findings for policymakers, legislators, funders in New Mexico, and not just New Mexico, really around the country, because we're a part of a big national community of practice when it comes to GI. But hopefully we'll drum up so much interest that there will be an investment in the future for specific kinds of GI projects, which again is very different than universal basic income. So there's no other question.
Yeah.
And the words and other things. Yeah, so Come Together was the main funder for the GI.
The community members came from a national fundraising in the local centers where foundation
So you have this in the second? These are the funders. They're here. Now, CBRE and together were the main funders for the, and really primarily for the actual payments. And then the rest really funded the research, the administrative, the policy design, the surveys, the extra, and so it was, those are all the funders that really supported this.
And the administrative support is basically through the platform, issuing the payments that you have these, so like must do that, or work as a collective, designing.
But the 2 million essentially under the asset payments.
That was also that. It was slightly, it was 150. But for the extension was probably, I think it was like 2.3. Yeah.
And yeah, I guess, are there any specific, legislators have expressed interest? So there was a hearing that the speaker put together about a year ago, specifically on GI, and hasn't had the results. So,